Along with all of the beautiful flowers come the pesky allergies.
Yeah, we're joined this morning by allergist and immunologist Dr. Neil Parikh for some tips on how to make it through this season. How are you?
Great. Thanks for having me.
Yeah, thank you very much. You are with Dignity Health Mercy Medical Group, and you see a lot of people always, especially this time of season, right? Springtime. Correct.
This is usually at one of our busiest times of the year because of those seasonal allergies that a lot of people suffer from.
Does do allergies lead to something else, or is it something else that leads to allergies?
Well, allergies can cause a lot of symptoms in themselves, like nasal congestion, runny nose, sneezing, itchy eyes, coughing. But what a lot of people don't realize is there are a lot of other conditions that are affected by these allergies, like asthma, sleep apnea, people who have recurring infections, all can be also directly related by having these allergies.
Okay, and so if somebody suspects that they're having a hard time breathing, obviously they should go see their doctor. When is the next step to go see an allergist?
So that's a great question. I think there's really not one patient who wouldn't benefit from seeing an allergist, but I may be a little biased there. But the reality is it's all about education and understanding what's driving your symptoms. And what an allergist can do is test you for allergies and actually tell you what you're allergic to. And by doing so, can help you predict and manage those symptoms from those allergies. And a lot of the symptoms that are allergy related can be confused for other conditions. So having that knowledge and information can only be helpful.
Okay, we're wanting to know, like some of the questions here that you have, what can Sacramentans do to prevent exposure?
So that's a great question and something we talk about often. So pollen is released by trees, grasses, and weeds, and so those are found outside the home. But that pollen can also come inside the home. So in terms of inside the home, you can get air purifiers, like HEPA air purifiers, which remove the pollen that comes from outside in.
Okay.
Understand that when you go outside and you breathe in that air, you're exposed to the pollen. So the longer it stays on your body, in your nose, and your eyes, and your sinuses, the more likely you're going to react and feel bad from them. Okay. So for that reason, if you're outside and the pollen counts are high, when you come in, you want to shower, change your clothes, do a sinus rinse with saline water. That will help reduce the chances of you feeling bad from these allergies.
And then go outside, especially when it's windy.
Well,
try to avoid that.
You want to try to avoid that, but what I tell patients is when they come to see me is we want you to be able to do everything you want to do despite having these allergies. So these tips and all these treatments that we have to offer, we do it so that you have a good quality of life. We want you to enjoy the spring, enjoy everything you want to do outside. And that means managing your allergies that way.
Okay.
When you walk through the drugstore aisle, sometimes there's a little bit of decision paralysis because it feels like there's a lot of treatment options. What do you suggest?
So for allergy treatment, so nasal steroid sprays, oral antihistamine pills, there are also people who suffer from allergy-related eye symptoms, so they're antihistamine eye drops. All these things can effectively reduce symptoms. You want to limit regular use of some of these other medicines like decongestants for the nose and decongestant pills. Those are not necessarily recommended for long-term regular use, but they're often found in that same aisle.
All right. Well, thank you so much for being here today. I know a lot of people are suffering through allergies right now. It's springtime here. mymercymedicalgroup.org for more information here. And they're on Instagram as well, Dignity Medical Groups. Thank you very much.
Thank you.
We will be right back. Achoo!
Yeah, my nose has been running lately.